One.
Morning everyone, my name is Dr. Cedric from Queen Elizabeth Hospital, Sports Medicine Unit. So today I'll be talking on ulnar collateral ligament of the thumb, or otherwise we known as the skier's thumb or gamekeeper's thumb. So definition of it, what is it? It is an injury caused by damage to the ulnar collateral ligament of the thumb. So for the classification, we go about the UCL instability grading. It is divided into 3 gradings: grade 1, grade 2, and grade 3. So grade 1 indicates that there is a sprain with no joint instability, otherwise the incomplete tear. Grade 2 is also an incomplete tear, but there's is asymmetric joint laxity and there's endpoint present, where grade 3 indicates complete tear. Pathophysiology of it, mechanism of injury, how does it happen? It's normally it happen when there is a radially directed force causing hyperabduction moment at the thumb at the metacarpophalangeal joint. Damage may also be caused by combination of torsion, abduction, and hyperextension at the first metacarpophalangeal joint. So as for risk factors, who are at risk of getting this? It is common in many contact sports like basketball, football, and also non-contact sports. So commonly seen in football players, basketball players, and also those who play downhill skiing. Chronic injuries may also happen due to attenuation of the ligament under repeated stress. For the clinical manifestation, first we ask history, where patient will normally tell that they have a fall with outstretched hand and the thumb in abducted movement, or where we have patients who play sports like basketball, where the thumb is hit by ball and the thumb goes into hyperabduction moment. So symptoms, how do they present? They will have pain at the ulnar aspect of the metacarpophalangeal joint, and it is worse when they try to pinch or grab something. For physical examination, inspection, we will look for swelling at the metacarpophalangeal joint, and discoloration and tenderness can also be palpated along the ulnar aspect of the metacarpophalangeal joint. We must take note that if there is marked swelling and ecchymosis, it is suggestive of a severe ulnar collateral ligament damage. And when we examine patient, if we see marked swelling and also ecchymosis, we must also think of a sesamoid fracture. And sometimes lump at the ulnar aspect of the metacarpophalangeal joint is indicative of sternus lesion. Okay. So what is sternus lesion? It is an avulsed ligament with or without bony attachment that is displaced dorsally and superficially to the adductor aponeurosis of the thumb. So for range of motion, we will do the radial and ulnar stress exam. Okay. So radial instability in 30 degree of flexion indicates injury to the proper ulnar collateral ligament, and radial instability in extension indicate injury to the accessory and the proper ulnar collateral ligament and or the volar plate. Other provocative tests that we can do is the anterior and posterior drawer test, and the amount of translation and absence of endpoint may signify the volar subluxation and radial collateral ligament rupture. And we can also test the resisted pinch, where there is weakness in the resisted pinch. For further assessment and imagings, we can do X-ray of the thumb in PA lateral and oblique view, where we will look for avulsion or the condylar fracture, and we will also look for sex sign. Volar subluxation and also of the proximal phalanx can be seen in lateral view of the thumb X-ray. Okay, and MRI is also good to do because the sensitivity and specificity is 100%. However, we don't really do in all cases here. And we can also do ultrasound, but ultrasound is operator dependent. For the treatment of it, generally we immobilize with spleen for 4 to 6 weeks in grade 1 and grade 2 partial tests. And for grade 3, we will refer to orthopedic for operative repair. Grip and pinch strengthening is also important to begin in 4 to 6 weeks time, because one of the complications that we are afraid of is a stiffness, and hence we must look out for this and start grip and pinch strengthening as soon as possible. Prognosis, if it is diagnosed and treated, we can return to play, and the return to play rate is almost 100%. That's all on the ulnar collateral ligament injury of the thumb. Thank you very much.